How often should you get tested for high-risk HPV? Have you ever wondered how often you should check for high-risk human papillomavirus? Understanding this can be a key part of preventing cervical cancer and staying on top of your reproductive health. High-risk HPV types are the main cause of cervical cancer, so regular screening is essential. But the timing depends on your age and health history. For people with a cervix, the main screening tools are Pap tests and HPV tests. If you're between 21 and 29, health authorities recommend getting a Pap test every 3 years. During this time, routine high-risk HPV testing alone isn't usually advised. The focus is on detecting abnormal cells early with the Pap test. Starting at age 30, the options expand. You can choose to have an HPV test alone every 5 years, a Pap test every 3 years, or both tests together every 5 years. The combined approach, called co-testing, is especially effective but might lead to more follow-up procedures if something shows up. It's important to note that screening isn't recommended for those under 21, regardless of sexual activity, because HPV infections in young people often clear up on their own without causing problems. For those over 65, screening can often be stopped if you've had regular screenings without any high-risk issues. If you've had a hysterectomy and no history of high-grade precancerous lesions or cervical cancer, routine screening is generally not needed anymore. Even if you've been vaccinated against HPV, regular screening remains important because vaccines do not cover all high-risk types. Staying consistent with your screening schedule helps catch any infections early, giving you the best chance to prevent cervical cancer. While testicular cancer isn't linked to HPV, awareness of HPV's role in reproductive cancers highlights why following screening guidelines is so vital. Always talk to your healthcare provider about your personal risk factors and the best screening plan for you. They can help tailor recommendations based on your medical history, lifestyle, and any other health concerns. Remember, regular checkups and screenings are your best tools for maintaining reproductive health and catching issues early.